The most common tools for imaging and diagnosing the skeleton involve the use of X-rays and magnetic resonance imaging, MRI. The process of imaging with the use of X-rays is called radiography. The images produced are often referred to as X-rays, but are more properly called radiographs. The science of making bones, organs, or disease processes visible without surgery involves pathology, radiology, and nuclear medicine. Future modules will examine these disciplines and the terminology associated with them. Right now, let's just examine the diseases associated with bones and the skeleton. Osteogenesis imperfecta. A group of genetic disorders in which bones are not formed properly due to defects in the production of collagen in the bone. The bones are very weak and brittle and fracture easily with little or no trauma. Often, multiple fractures may occur simultaneously. There is a wide range of how severe disorders in this group can be. Hip dysplasia is a condition where the rim of the hip socket does not properly cover the femoral head. This is usually a congenital condition. Scoliosis is a sideways curvature of the spine often diagnosed in adolescence. According to the Mayo Clinic, most of the time, the cause of scoliosis is unknown, though it can occur in individuals with muscular dystrophy or cerebral palsy. There are several types of scoliosis depending on where the curvature in the spine occurs. According to the Mayo Clinic, rickets is a softening or weakening of bones in childhood due to a prolonged lack of vitamin D. Vitamin D helps the body absorb calcium and phosphorus. Rickets is usually due to dietary deficiency. However, some rare inherited disorders can also cause rickets. Rickets is less common in the United States in the last century thanks to the fortification of dairy products and other foods with vitamin D. Osteoarthritis is the most common form of arthritis. It occurs when the cartilage at the end of bones deteriorates over a course of years, which causes pain, swelling, and calcification of the joint. It is most common in the hands, knees, hips, and lower back. Osteoarthritis is often associated with aging and natural wear and tear on the joints. In fact, this type of OA is often called wear and tear arthritis. However, it may also appear prematurely in the case of joints traumatized by injury. Let's look at a before and after of a left arthritic knee replacement. As mentioned in the last slide, with long-time use and natural aging, cartilage wears down. Cartilage, tendons, and soft tissue in and around the joint become sclerosed or hardened and thickened. Calcification gradually replaces cartilage and soft tissues. Bone spurs form, which are calcified projections from bone surfaces. Arthritic joints can become painful or immobile and deformed. On X-ray, calcification appears as dense, opaque material around the joint, and the bones of the joint may appear misshapen. With rheumatoid arthritis, RA, damage and swelling of the joints is caused by an autoimmune disorder, where antibodies attack the lining of joints in a manner that is distinct from osteoarthritis. This immune disorder also damages many other systems in the body besides the skeletal system. Quoting a website by GoodRx, a pharmaceutical retailer, these are some of the differences between the two diseases radiologically. On an X-ray, there's less space between the bones in OA, but in RA, the bone is more eroded. That said, X-rays can be normal in either condition if it's caught early. Other imaging tests, such as MRI, can also be helpful. MRIs can offer more in-depth images of the joints. This can be especially helpful in the early stages of RA. An MRI can show joint inflammation even when X-rays are normal. We will look at MRI technology in a module on radiology in the future. Osteoporosis. This is a condition involving a loss of bone density where bones become weakened and brittle. According to Johns Hopkins, it typically occurs after age 50. The chances of osteoporosis increase with age. However, lifelong lack of calcium and/or vitamin D intake, chronic malnourishment, and decrease in body mass are also factors in this disease. There are many other factors as well, such as alcohol intake and smoking. The most common reasons for hip replacement include osteoarthritis or fracture of the hip. Osteoporosis can cause weakening of the femoral neck and fracture with normal use. Rheumatoid arthritis can also cause a need for hip replacement. The most common reasons for knee replacement include osteoarthritis or fracture in the knee joint. Though somewhat less frequent, rheumatoid arthritis can bring on a need for knee replacement. Fractures are a common injury to bone and can be caused at any age by a number of things, including injury and/or weak and brittle bone. After a fracture occurs, the body will attempt to heal and rejoin the bone regardless of medical intervention. However, medical intervention helps heal the bone faster, with greater strength of repair and with greater functionality of the repaired bone. Medical intervention assists and improves the natural healing process. However, medical intervention relies on the natural healing process for a good result. So let's look at the natural healing process for a fracture. After a fracture, a blood clot forms at the ends of the fractured bone. This blood clot forms a fibrous callus. Streamers of calcification, called cancellous or trabecular bone, gradually replace the callus. The ends of the fracture grow toward one another. This callus of new bone is not as dense or as strong as normal bone, but it is gradually replaced with dense cortical bone in the final stages of healing in a process called bone remodeling. Healing of a fracture leaves a telltale trace of protruding, rough bone, which a radiologist can spot on radiography. In this way, the presence of old fractures in the patient's history are revealed. In the event of uncovering skeletal remains, old, healed fractures are obvious on direct examination of the bones. Old fractures will show signs of healing, and late or post-mortem fractures will have retained their sharp edges. This assists forensic scientists and anthropologists in determining injuries or cause of death. Medical intervention for fractures. According to Medline Plus, there are three main categories of fracture repair in medicine. They are, number 1, casting, number 2, open reduction internal fixation, and number 3, open reduction external fixation. Casting is an immobilization of the fractured area, which allows for bone union after realignment. This is used when fracture is not complex and highly fragmented. The goals of casting are support and protection of the fracture, whereas the fixative surgeries are more about repair. In cases where less support is needed, splints can be used instead of casts. As stated, the next two options both involve surgery and reduction. Reduction refers to the realignment of bone fragments. In the case of internal fixation, pins, plates, and/or screws may be used to reconstruct the fractured area. Any hardware used is designed to remain in place permanently. It remains under the skin and soft tissues after surgery. Casting may still be used after surgery as well. However, ORIF is used when fractures are too complex for simple casting or the long-term use of a cast is not desired. In the case of external fixation, surgery is performed and hardware inserted, but support is apparent outside the skin and soft tissues of the fractured limb. This is the most complex kind of fracture repair and would be performed when ORIF is inadequate. The outside support will be removed when healing is complete. Now, let's review the various types of fractures that can occur. Simple fracture, aka closed fracture. Fracture occurs, but there is no protrusion through the skin. Compound fracture, aka open fracture. Part of a fractured bone pierces the skin and creates a wound. Compression fracture. The bone is crushed into multiple small fragments and appears wider or flatter than normal. Transverse fracture. A horizontal fracture across a bone. Longitudinal fracture. Fracture runs the length of a bone. Oblique fracture. Fracture forms a diagonal line across the bone. Spiral fracture. The fracture takes a helical path around the bone's long axis, common in twisting injuries. Comminuted fracture. The bone is broken into 3 or more pieces and fragments are present at the fracture site. Impacted fracture. The broken ends of the bone are jammed together by the force of the fracture. Avulsion fracture. A bone fragment separates from the rest of the bone. Segmental fracture. There are at least 2 separate breaks so that the bone is in at least 3 pieces. And green stick fracture. An incomplete fracture where one side of the bone is broken, however, the opposite side is bent but intact. We've come to the end of our introduction to bone and skeletal pathology. The next time I will post some exercises and questions on the material in skeletal anatomy. In the meantime, I hope you have come away with some idea of how dynamic the skeletal system is, always slowly changing to better suit our needs.